morning, I'm Gemma. I'm going to be your tutor today. So I wrote the plan of the day on the whiteboard. We've got our introduction, we're going to be doing theory on the PowerPoint, we'll have questions and answers, we'll break off for lunch about 12:30 and then we'll come back and do practical on the jelly heads and I'll be showing you how to hold the syringe and everything, okay? We'll have some questions and answers at the end of the day, a small exam just to see how much you've taken in today and how the day has gone, and then we will be giving you some homework as well for tomorrow. Okay? So I'll just tell you a little bit about myself, Laura. I'm Gemma. I come from a beauty background. I worked in beauty salons, I've worked on makeup counters, I eventually owned my own beauty salon, I've managed salons. I ended up going into laser hair removal, semi-permanent makeup. I've literally done everything that I possibly could in the beauty industry. About 4.5 years ago, when I realised that having beauty level 3, you could get into the route of aesthetics, I decided to come and train in aesthetics. So I've done a couple of courses and I loved it. I decided to go into teaching in 2019, but never really done anything with it. And this is why I'm back here now. Okay, so if you could just give me a little bit of, introduce yourself, just tell me a little bit about your background so I know what level you're at.
Okay, so my name's Laura. I've been in the beauty industry for quite some time. I started off with my beauty 2, beauty 3, and then I was under the understanding that I could get into aesthetics. So I looked into various courses.
Amazing.
And chose to come to you.
Yeah, amazing. Very good. Okay, yeah, so today we'll be going over, obviously it's a beginner's course. We're going to be literally going through everything from start to finish with your anatomy. So what we normally do is when we first start out, we keep our phones turned off while we do the PowerPoint. I would like you to take as many notes as you can, and then we'll be going over questions and answers at lunchtime, okay? So I'm going to get cracking on with the PowerPoint. Take as many notes as you need to. Everything that's on the PowerPoint will be in your handout already, but we like to just go over everything. There's going to be quite a few things in here that's going to be in your exam today as well, so take as many notes as you can, and if you're unsure of anything, we'll go over at the end of the PowerPoint. Okay. Fire exits as well. I know we've already gone over the risk assessment, but the toilets are just behind the door and the fire exits are just at the back of that door there.
Alright.
Okay. So we're going to be talking about filler this morning, dermal fillers. So I've got 2 boxes here, 2 different brands. There's loads of different brands on the market at the minute. Every filler is hyaluronic acid and it will come in 3 different types. So you'll have a medium, a fine and a deep, a subcu. So it's the different consistency. So you'll have a finer filler, which will be for the lips, like for an older lady. Thinner lip is a thinner consistency. You'll have a medium, which is a little bit thicker, and then you'll have your subcu, which is like a thicker consistency, and that's going to be for your advanced techniques, your jaw and your cheeks. But because we're on the foundation, we're going to be using a medium filler, which is going to be for the nasal folds, the lips, and the marionettes. Okay. What I suggest you do is find one brand of filler that you like, and kind of stick to that, because we can't cross fillers over, okay? We can't use them for at least 3 to 6 months, so try and stick to one brand. Okay, so I normally charge around 100, 150, depending on what area. It just depends on the other practitioners around your area. We've got quite a few in Manchester, so your filler price is priced from £30 to £100. So you've got your low budget ones and then you've got your premium ones. Okay, we can go more into different types of filler, and we'll give you the wholesale where you can buy that from as well. So you can buy filler with your certificate if you pass at the end of the week, and you don't need to have a prescriber. With your Botox, there's more legalities. So with your filler, you need your prescription, you'll need an emergency kit, and you'll need your insurance. Okay? So we need to stick to certain danger zones with the anatomy. It's really important sticking to certain landmarks when we're injecting dermal fillers. We need to make sure that we're out of the high risk danger zones, and some of the arteries that you'll need to know about on the foundation are going to be the supratrochlear artery, the angular artery and the infraorbital artery. So if you can make notes of them, they will probably be in your little exam at the end of the day, okay?
Okay.
So the anatomy, the angular artery, so this runs down the terminal part of the face. You've got your superior, this supplies the upper lip, and then you've got your inferior, which is the underneath. This artery supplies the labial glands, the muscle membranes, and then you've got the muscles of the lower lip. So the anatomy of the lip, it's really important we understand the anatomy of the lip when we're injecting. We need to, everyone's anatomy is completely different, so it's really important when we're injecting. We don't inject into the oral commissure, and we'll be going straight to the vermilion border and then going into the body for volume, okay? We need to go over complications really quickly as well. So there's many different types of complications with having lip filler. You can get, bruising, swelling, redness, bleeding. That is absolutely normal. You're putting needles into your lips, very sensitive area. What you do need to be aware of is vascular compromise and vascular occlusions. So your vascular compromise is a partial blockage of a blood vessel. It can occur within the walls of the vessel itself or through pressure from the product sitting in the tissue outside of the vessels once it's been injected. Vascular occlusions, this causes a decreased blood flow, which often leads to rapid cell death that occurs not only locally, but often spreads to nearby tissues which share the same blood supply. The condition whereby tissue is deprived of adequate oxygen is called hypoxia. This constitutes a medical emergency and must be treated immediately to avoid irreversible damage to the face. So what we need before you get started, Laura, by the end of the week is an emergency kit. You need hyaluronidase to dissolve. If you was to get a complication like this, we need to know that you can dissolve, and we need to have an EpiPen. Okay, so we can provide that for you towards the end of the week. But now knowing this, I'm going to go over a little bit of practical with you, and I'm going to practice on the jelly head, okay, and then I want you to follow. So I'm just going to get rid of the laptop. Okay, so we're going to go into practical now. So I'm going to pop my gloves on. Have you ever seen filler before, Laura?
No.
Have you ever had filler yourself?
Yes.
Yeah, so you know how it feels. That's good.
Yeah.
I always recommend getting treatments done to yourself before you obviously go into doing them on other people. It's really good to obviously, you know how it feels, you know what to expect, you can explain to your clients what they to expect. Okay, so this is how I would like you to hold your syringe, okay? I just feel like you have more support holding it this way, upper rather than underneath. So the aim is to keep the bevel facing up. Do you know what a bevel is?
No.
Okay, that's fine. So it's that little hole at the top of the needle.
Okay.
And it's the pointiest part which is underneath. That is going to be the sharpest part that enters the skin first. So that goes into the lip first. Obviously to go into the lip, it's just going to make it easier than it turned the other way. Also, we want to make sure that the filler is obviously coming out at the top. We want to know where we're placing our filler. So when I say bevel up, it means that the little hole is facing up. So the techniques that we're going to be doing is going to be linear thread and a cross hatching. It's like a little hashtag, so that's what we're going to be using on the marionettes. And we're going to be using a linear thread for the nasal fold and the lips on your foundation. Okay, so we want to get, it's like a jelly consistency, it's hyaluronic acid, it's easy to break down if we was to get a complication. So we want to be aiming to get a nice straight line like so.
Okay.
Okay, it needs to be consistent on each injection around the lip to build the lip. We don't want to be having a lump of filler like that and then none and then another lump. It needs to be consistent, around the lip. Okay, so this is going to be to build up the lip, and then we're going to be doing a hashtag, so to say, when we are doing our marionettes. Okay, so these are the two techniques that you're going to be learning today. Okay, so we're going to go and have a little bit of practice. So if you just keep a close eye. I always like to start, I always aim the needle in the way that I'm injecting. So a nice big stretch. I support my hand. I put just the bevel in. That is my guideline to how deep I need to be. I only want to be 3 millimeters deep. You've got your arteries that run between 6 and 8 millimeters. We want to make sure we've got the correct depth. So nice big stretch. Support your injecting hand. We're going bevel in, straightening up. Support your hand on the face. We aspirate for 10 seconds. Aspirating is where we pull back on the plunger and we get a little bubble just there. Can you see that? If we was in a vessel, this would fill with blood. Okay, so we know not to inject any filler.
Okay. Can you still use the same product?
Yeah, so you could if this was to fill with blood, do you mean?
Yeah.
Yeah, so what we do, we take the needle out, we change the needle and we push the little bit of filler out that had the blood in, and then we go back in because it's been used on the same person.
Okay.
Yeah, it's okay to go. Okay, so we'll go in, bevel in, straighten up, aspirate, make sure that we're safe, there's no blood there, we can now inject. Swapping hands over, pull out, and this is what we want to achieve, one of those linear threads. Okay, would you like to have a little go?
Yes, please.
Okay.
Okay. So the bevel needs to be up.
That's it.
Which way shall I go?
So do this top one first for me, so a nice big stretch. That's it.
And then going.
Yeah, so bevel in, straighten up, make sure your finger's nice and wide so you don't get a needle stick injury. That's it, aspirate. That's good for 10 seconds. Okay. Very good. Yeah, that was really good. Okay, yeah, so we're just going to keep practicing on the jelly head.
Okay.
And let's go over some questions and answers. Do you feel like I have explained everything to you today, Laura?
Yeah.
Yeah. Is there anything you would like me to go over?
Yeah, I'm a little bit scared of getting vascular occlusion. Have you ever had one before?
So I've never had a vascular occlusion, they're very rare. So don't let that panic you. As long as we know how to deal with a vascular occlusion, which is what we teach on this course. So as long as you know how to dissolve, you know the signs and symptoms of vascular occlusion, you know that is every practitioner's worst nightmare, and that's what everybody gets anxiety about. But if you're really confident with dissolving, you're not going to have those anxieties. And like I say, it is rare. But yes, you do need to be prepared for that if that was to happen. Okay? But don't worry, you're going to be 100% because we're going to go over and over and over until you feel confident. Okay? Is there any other questions that you'd like to go over?
Yeah, my emergency kit I'd like to buy off you. How do I go about that?
Okay, so we have a prescribed that comes into the clinic. It is prescription only. Like we went over before, so you'll get your EpiPen in, you'll get your hyaluronidase, and you'll get some Emla cream as well. Yeah, our prescriber will come in and can prescribe that. It's £160, okay? But you will get that towards the end of the week when you pass. Okay?
You mentioned Emla cream. Can I not use a stronger numbing cream?
You can't, I'm afraid, no. So what happens with the stronger numbing cream, Laura, it blanches the skin.
Okay.
So it will make the skin go white. It's not only, it's illegal as well to use anything more than 5%, but if we was to use it and the skin was to blanch, you can't get a capillary refill. So if we was to have a complication, a blockage, a vascular occlusion, that is the first signs of a blockage, the whiteness.
Okay.
Yeah, so we can't use any more, unfortunately. So your Emla cream will just take the pinch away, but you'll be able to get through. I normally leave the Emla cream on for about 20 minutes, okay, 20 to 25 minutes.
Okay.
Okay, is there anything else you'd like me to go over?
No.
Okay, so you're going to have a little exam now to do.
Okay.
And it's just over everything that we've learned today, and if you could give me some feedback as well, you know, and let me know how today's gone. I'm going to give you some homework as well for tomorrow. You've got some muscles that I want you to learn as well. So we're going to go over the anatomy, and I will be giving you your little exam and your homework to take home as well.
Okay.
Okay, have you enjoyed today?
Yeah, thank you.
Yeah, alright, great, that's great. Thank you so much, Laura, and we'll see you tomorrow.